GLP-1s or glucagon-like receptor agonists are a class of medicines that are used for type 2 diabetes as well as for weight loss. They were initially developed to treat diabetes because they increase insulin secretion from the pancreas, they stabilize or lower blood sugar, and we learned in this process that the medicine actually increases fullness and induces weight loss. So years after these medicines were approved for diabetes, a few were also approved for weight loss because of the efficacy and the good safety profile of these medicines. Obesity medicine specialists that are board certified do prescribe these. They are becoming the gold standard of care. They're extremely effective and safe for obesity treatment. They are in high demand right now. Patients are hearing about them, but again, we don't want our patients dictating their care. We need to prescribe what's safe and what's effective, what's cost effective, and what makes sense. In terms of efficacy, we can see 15 to 20% loss of total body weight. These medicines do have an excellent safety profile, and some have shown positive cardiovascular outcomes. So less heart attacks, less strokes, and less cardiovascular death. Wegovy, Ozempic, those are GLP-1 agonists. They target one hormone pathway. Wegovy is FDA approved for weight management. Ozempic is still, is indicated for diabetes. The newest medication, tirzepatide, which under the name Mounjaro is used for diabetes, leads to almost as much weight loss as bariatric surgery. And one of the reasons it's so efficacious is because it's what we call a dual agonist. It mimics two weight regulating hormones in the body, not just one. So GLP-1s alone are not going to solve the obesity epidemic. There are people that don't respond, even in clinical trials, in real life. There are patients that this isn't the right medicine for, either because it doesn't work or they don't tolerate it. My concern today is that normal weight people are getting their hands on this and taking it to lose 5 or 10 pounds. That's, potentially where there could be safety concerns because that's not who the meds were studied in. There are several studies looking at data a few years out. And then there's also some academic centers that have published data looking at patients that are on the meds for several years. But I have this conversation with patients all the time in terms of like real world, decades of data. We don't have that, which is why it's so important to look at the, risks versus benefits when we're prescribing a medication. These medicines do have to be continued to some degree in the long term. When people stop the medicine, they will regain weight likely within a year or a significant amount of the weight. And this is true when we think of any medicines to treat obesity, and we think of it in the sense of a chronic disease. We don't take people off their cholesterol medicine or high blood pressure medicine as soon as it works, because we know that their body's going to revert to its set point state of hyperlipidemia or hypertension. And that's true for set point body weight as well. People might be able to remain off medicine for some period, but typically the body weight drifts back. Absolutely. And that's a great way to treat complex patients, is to combine medicines with different mechanisms of action to achieve better results.